Hello everyone, I am Dr. Ruchika and welcome to Creating Balance. Although vitamins and minerals are micronutrients, that is, they are required in very small amounts by our body. But as our bodies can't produce them on its own, so we need to get them through our diet. Whenever we have any nutritional deficiency, we can see various symptoms in our body. And these symptoms are our body's way to tell us about that potential vitamin or mineral deficiency. And by recognizing them, we can adjust our diet or lifestyle accordingly. The two most common reasons for any vitamin or mineral deficiency are: first is that we are not having enough of that mineral or vitamin in our diet. The second reason is that due to some underlying cause, our bodies are not able to absorb that particular vitamin or mineral properly. Now in this video, I will talk about two very common deficiencies. First is iron deficiency and vitamin B12 deficiency. I will talk about their causes, their symptoms, and how you can deal with them. So let's begin the video. Now let's talk about iron deficiency. The most widespread nutritional deficiency throughout the world is iron deficiency. According to WHO, over 30% of world's population is anemic, and many of these people are anemic due to iron deficiency. Iron deficiency anemia affects so many people that it is now widely recognized as public health epidemic. Iron is required for the formation of hemoglobin by our red blood cells, and whenever there is an iron deficiency, the level of RBCs in our body will be abnormally low, and this condition is known as anemia. Now let's talk about the causes of iron deficiency. The first cause is inadequate intake of iron through our diet. Whenever we are not consuming adequate amounts of iron through our diet, it can lead to iron deficiency in our body. Then inflammatory bowel disease can also lead to iron deficiency. There are certain conditions also where the requirement of iron is increased in our body, such as pregnancy. In such conditions, when the requirement of iron is increased, we need to increase the intake of iron. So these conditions might also lead to iron deficiency. Then whenever there is excessive blood loss due to any injury or due to any surgery, or it might be due to any other reason also, the excessive blood loss can also lead to iron deficiency. Now let's talk about the signs and symptoms of iron deficiency. Although the signs and symptoms of iron deficiency will vary according to the severity of the problem, but the most common signs and symptoms associated with iron deficiency are: first is unusual tiredness. Fatigue is the most common symptom associated with iron deficiency. It is due to less oxygen supply to our body tissues, which will deprive them of energy. The next symptom is paleness of the skin or paleness of the inner surface of the lower eyelid. Now this paleness is due to less hemoglobin in our blood. Hemoglobin provides red color to our blood, so whenever there is deficiency of hemoglobin, our skin might appear pale. The next symptom is shortness of breath. Hemoglobin helps red blood cells to supply oxygen to the various tissues of our body properly. And when the hemoglobin levels are low, our body tissues won't get sufficient oxygen, not even to do our daily tasks like walking. So these daily activities also will increase our breathing rate because our body tries to get in more oxygen. The next symptom is restless leg syndrome. Restless leg syndrome is very commonly associated with iron deficiency. In this, there will be a strong urge to move our legs whenever we are in rest position. And this symptom is very prominent during night when we are sleeping. Then the person might have cold hands and feet, or the skin and hair might be dry and damaged. Then the tongue might also appear sore, swollen, or the tongue might be very strangely smooth. The nails can also be brittle and spoon-shaped. This can happen only in the severe cases of iron deficiency. If you see such symptoms in your body, then you can consider adding iron-rich foods to your diet. Iron-rich foods are dark leafy greens like spinach, then raisins and apricots, beans and other pulses, seeds and nuts, fruits like pomegranate and apple are also good sources of iron. It is also important that your body properly absorbs the iron that you are consuming. And there are many ways by which you can boost up the iron absorption by your body. The first thing is you can eat iron-rich foods along with vitamin C-rich foods, because vitamin C helps to increase the absorption of iron. Then when you are anemic, it is also advisable to reduce the intake of tea and coffee, because both tea and coffee interferes with the absorption of iron. Especially avoid them along with your meals or along with the iron-rich foods that you are consuming. Then also avoid consuming iron-rich foods along with calcium-rich foods like dairy products, because calcium also interferes with the absorption of iron in our body. If your symptoms don't subside even after changing your diet, then you should consider visiting your doctor. The next vitamin deficiency that I am going to talk about is vitamin B12 deficiency. Vitamin B12 is a water-soluble vitamin and has many functions in our body. Like it helps in the production of our red blood cells, our DNA, and it is also helpful in the proper functioning of our nervous system. As our bodies can't synthesize vitamin B12, so we have to take it through our diet. Now, deficiency of vitamin B12 is very commonly seen with people who are strict vegans, then elderly people who are above 60 years of age, then people who have had stomach surgery or gastric surgery. Also people who had surgery to remove a part of their bowel which helps in the absorption of vitamin B12. Those people are also prone to vitamin B12 deficiency. Then diabetic people who are on metformin. Also people with a long history of antacid use are also prone to vitamin B12 deficiency. Then people who lack intrinsic factor are also very prone to vitamin B12 deficiency. Intrinsic factor is basically secreted by our stomach and it binds with vitamin B12 and take it to the small intestine for absorption. Now let's come to the symptoms of vitamin B12 deficiency. Unfortunately, the symptoms of vitamin B12 deficiency can take years to show up, and diagnosing vitamin B12 is quite complex. But the common symptoms are pale or jaundiced skin. As vitamin B12 is needed for the production of DNA, which is required for the production of red blood cells, so people who are deficient in vitamin B12, they might have pale skin or they might have yellow tinge to the white of their eye. Now, as in case of iron deficiency anemia, the inner surface of the lower eyelid has a yellow tinge. But in case of vitamin B12 deficiency, the white of the eye has a yellow tinge, just like in case of jaundice. Now, the next symptom is changes in the mobility of the person. The long-term deficiency of vitamin B12 can actually damage your nervous system. So it can lead to the change in the way the person moves or walks. There might also be changes in the balance and coordination of the person. Then dizziness or breathlessness can be there. The tongue might appear red and swollen and there can be mouth ulcers. Disturbed vision can be there, and tiredness is also a very common symptom associated with vitamin B12 deficiency. Now the rich sources of vitamin B12 are usually the animal products like dairy products, fish, egg, meat. These are good sources of vitamin B12. Also make sure to visit your doctor and get your vitamin levels checked. That's it for today's video. Thank you very much for watching.